Welcome back to Shaw Spotlight. I'm here with Dr. Stewart Kennedy. Dr. Kennedy, a lot of things have changed since the last time we spoke at the Thunder Bay Regional.
You know, it has, and last summer we were quite good, with our numbers here in Thunder Bay, but as you've seen, Janice, that our numbers really have exploded over the past week. As the Thunder Bay Health Unit has announced, there's 56 active cases in the community at this point in time. And certainly a good number of them related to an activity, a physical activity that the health unit is on top of and tracing all contacts. And unfortunately, as of last evening, we've had one admission with COVID-19 to the hospital. We've actually have had no admissions since probably, I think, May or June. So this is all new. I think this just needs to remind the public to take heightened precautions because of the prevalence of the disease out in the community. So I think it's we owe it to ourselves and our neighbors to really take those heightened precautions now more than ever because of the increased prevalence in the community.
Now, could the rise in numbers, I know there's a lot more testing being done as well. Does that make a difference in the numbers?
No, we've been testing all symptomatic patients or clients since this pandemic started. Certainly, there are more symptoms with cold seasons around, so we're testing more people. But I believe it's not related to the increased testing. It's just more related to the influx of COVID-19 into the community, and there's a good number also travel related. So I think I think as far as travel goes, I think we should really limit our travel outside of northwestern Ontario, except for essential travel. And when you do come back from travel, I am recommending that you isolate in your home for 7 days to make sure you're not having symptoms when you go back to the workplace. Now, that's not always possible, I understand, but certainly if you're going through non-essential travel, we don't encourage non-essential travel, but if you are going with Christmas break coming, I think it'd be good to plan when you come back or if you have any visitors coming up to see you, that you really should self-isolate for the 7 days while we have such a higher prevalence in the community. And it's most important, I mean, the vaccine is right around the corner, and we really want to control the spread of COVID-19 until the vaccine gets here, because it's promising news, and I'm hoping the springtime we can begin immunizations, but much of that is out of our control.
Now, you mentioned 7 days. How has that changed from the 14 that was suggested before?
Great. The research lately has said the initial research is 14 days, but we know 95 to 96% of the population who's been exposed to COVID-19 will actually present with symptoms within 5 to 7 days. So if you don't have any symptoms after the 7 days, we're quite comfortable saying the isolation of 7 days is adequate. There may be a very small fraction that escapes through that, but we also know human behavior, and it's much easier to have the self-isolation for 7 days instead of 14. From a healthcare facility, it's difficult for us to have our healthcare workers out of the workforce for 14 days. So we've done the research, and it's research from Winnipeg and international research, and we're comfortable making that decision.
Now, when it comes to testing, I know there's a few testing sites in town. Is the hospital doing any testing?
Oh, yes. So what happens, we have the hospital is the sponsor of the 2 assessment centers in town. We have the one, we just moved into a new site. We used to have the trailers outside the emergency department, and now we're at 980 Oliver Road, right adjacent to the hospital. So we have indoor space now, so people aren't sort of waiting out in the cold. So that's a positive. And we're also still supporting the site at the Confederation College, and that's more for the asymptomatic patients, for the school children, for the teachers, for the parents, as well as for long-term care testing for our individuals who are visiting their family long-term care. So we try to separate best we can the symptomatic from the asymptomatic patients, and that's why you have 2 sites. So those are the only sites we have, but the paramedics are still doing in-home testing, and all the testing of swabs will come to Thunder Bay Regional Hospital. Then we'll do priority swabs here, and then we'll actually have the public health lab do the other swabs either here locally or in the sent to Toronto.
Now, is there anywhere that people can go to get tested if you don't have symptoms, or do you have to have 1 or 2 symptoms to get tested?
We recommend that you only get tested for symptoms, except if the healthcare unit feels you're a contact, they will refer you to the assessment center, or if you're going to visit your loved ones in long-term care, they're asymptomatic, they should get tested. Otherwise, if you have sort of no symptoms, we're not recommending get tested because the yield is so low and it just backlogs the whole system. And that's why sometimes in the summertime you're hearing about 7 or 9 days turnaround. We've got our turnaround here in Thunder Bay, certainly we can do priority turnaround time in 3 or 4 hours, but certainly with using the public health lab resources and Toronto, we're getting turnaround times now about 2 or 3 days. Sometimes a bit longer, but that's certainly it's reasonable now.
Now, you mentioned earlier that there still are some people traveling, whether it's for essential travel or some for non-essential. Is there anything that they can do? Can they get tested when they come back, or is it just the isolation that they should be doing?
It's just the isolation that we're doing because we don't want to overwhelm the testing system, and we want to discourage travel. So if they know they're going to get tested and they come back, I think they may travel more. But we do our testing for individuals who are an essential care worker, okay, who or has to have something performed at the hospital if they have traveled. We will test them as a priority. So again, if you're a patient who has traveled and returned for some type of diagnostic test and cannot do the 7-day isolation, we will do the testing so we do not expose our healthcare workers to COVID-19.
Now, even though there has been a rise in numbers, people are wearing masks, people are doing distancing. Like, is all that still helping to stop the spread?
Oh, that's our best method to fight this, Janice. I mean, to making sure you wear your masks at all times. We're finding more and more now with the spread of COVID-19. It's happening in informal gatherings, larger sort of house-dwelling gatherings, in some places of employment. And we're really encouraging individuals and gatherings to limit your gatherings now while we have a lot of COVID-19 in the community, and only sort of go out for sort of essential needs because of the COVID-19, but we know people are going to go out. So it's very important that they take all those precautions because the mask, the physical distancing, and the hand washing is our best fight against this. And certainly with the current number of cases in town, I think we've let our guard down in certain areas, and no one's fault. I think we just all let our guard down, and we do have a super spreader right now in the community.
Now, what about with the cold? Like, it is cold and flu season. How do you know when you just have a cold?
Yeah, I mean, you all know your own body. So if you just have a runny nose, one symptom, and I certainly wouldn't recommend getting tested. But certainly still, if you're just feeling off, your body is really fatigued, you have increased shortness of breath, you certainly have a fever. Those major signs is certainly either get tested at the assessment center or get a hold of your healthcare provider to have an assessment. But certainly, but if you have any question at all, if you're not quite sure, phone the health unit, phone the assessment center, and get a test. There's no harm getting a test done whatsoever. You'll have to self-isolate once you get your test, but I think you want to protect the public. So even minor symptoms that doesn't seem right to you, if you're feeling a bit off, get tested because we don't want you coming to work and we don't want you sort of going into gatherings. We want to take all the precautions we can so we really control this virus here in Thunder Bay.
Now, I know since we've had a rise in cases, a few things have changed at the hospital in terms of caregivers and essential caregivers and things like that. Can you just explain a little bit about what's happening there?
These are always our most difficult decisions regarding care providers. So right now, we're limiting our visitors to the hospital to essential care providers. And that is for individuals who are in the hospital or who are coming for outpatient procedures that need assistance. And I think that's the best way to put it, need assistance. Either they have communication problems, they have mobility problems, they have memory problems, Labor and delivery, we want their partners to be supporting them for labor and delivery. Palliative care, for sure we want to make sure we have care partners for them. So certainly we're going to be, so that if we want to err on the side of the patient needs, but we want to also prevent flow into this hospital because there's more COVID-19 than we've ever experienced in the community, we want to protect the hospital environment.
Now, I know because of the rising cases, just in talking to my friends and people I work with, people are getting nervous. They're getting very nervous about it. Do you have anything you can say to them?
We're getting back to where we were when this first came in March, the anxiety, the heightened anxiety, actually, right? And that's sometimes a good thing, because if they're nervous and anxious, they'll take the precautions, they'll limit their gatherings. So that is a good thing. So I don't mind a little bit of anxiety. Certainly, we don't want to shut things totally down from the hospital like we had before, because we've learned so much over the past 6 months. And we learned the morbidity and mortality by shutting things down far greater than experiencing increased rise of COVID-19 in the community, because our wait lists are still are long, but we're making a good dent in them over the summer months. And we're going to continue to run full service here at the hospital as long as we can, but it's everybody's responsibility to help us there, so we actually do not have rising numbers that are going to have an impact on our ability to manage the care of patients. So we need to protect our ICU beds. We need to keep more capacity here at the hospital in case we get a spread of COVID-19. And we do not want to cancel surgery. We do not want to cancel diagnostic procedures. We want to continue on to deal with the backlog. But we need the community's help to take all those special precautions.
Dr. Kennedy, thank you so much for talking to me about this today, and hopefully the next time we talk we'll have lower numbers, because everyone's doing their part.
I'm hoping that too, Janice. You have a good day.